The 8-bed capacity intensive care unit for the Effia-Nkwanta Regional Hospital in Sekondi was funded by GIZ's Governance for Inclusive Development program. In handing over the unit fitted with German technology costing over 1 million Ghana cedis, the GIZ's country manager for inclusive development, Raphael Frekin, said the facility was originally built and funded by GIZ at the onset of the Ebola crisis in 2016, but was not used. Hence, it had to be renovated to handle COVID-19 cases.
The refurbishment and rehabilitation of this 8-bed intensive care unit for treatment of COVID-19 patients with severe symptoms is one of the priority areas of assistance to the government of Ghana by the Governance Program. I must emphasize that this facility we are handing over today was originally built and funded by GIZ at the onset of the Ebola crisis in 2016. The COVID-19 outbreak made it necessary to refurbish and execute additional works that enables the unit to function at the highest medical standards in the handling of severe infectious diseases. This 8-bed unit boasts of 8 state-of-the-art ventilators and accessories, 4 of which have already been installed, and the remaining expected soon. It needs mentioning that at the onset of the pandemic, there were not more than 30 ventilators across all hospitals in Ghana. Hence, you can picture the critical importance of the provision of these 8 ventilators for this hospital. 3 months supply of consumables for the ventilators. Thereafter, the hospital assumes responsibility. Hospital waste incinerator for the proper disposal of medical waste, thus keeping the community safe from the ill effects of untreated waste. Doctors, nurses, changing room and workstations. A decontamination room where the medical staff can safely be decontaminated after attending to the patients.
Mr. Frekin also announced the planned construction of a 28-bed isolation unit at the communicable disease unit of the Effia-Nkwanta Hospital. The unit will also be financed by GIZ's Governance for Inclusive Development program. The Western Regional Minister said the facility had become necessary after 14 people died from COVID-19. He was thankful to the German government for the investment made in the unit.
Let me express my profound gratitude to the German government, working through the German Development Agency, GIZ, for the enormous financial and technical support given to refurbish and equip this facility. I am told that the investment from GIZ alone is in excess of 1 million Ghana cedis, excluding the estimated 500,000 Ghana cedis expected to be spent on the refurbishment of the 28-bed isolation center at this very hospital. We have unfortunately recorded 14 COVID-related deaths. Thankfully, as I speak now, there is no active COVID case in the Western region. So, yes, I know some of you would have wished that we can remove our mask, but prevention is better than cure.
Medical Director for the Effia-Nkwanta Hospital, Joseph Kojo-Tambel, said the facility was coming at a time when they did not have any active COVID-19 case. He told Citi News the presence of the unit marked the end to the transfer of critical COVID-19 cases from the Western region.
In the height of the pandemic, we were crying for a place like this, where we can admit and treat the severest of cases, without having to transport them for distances. So this is a very welcome project, and it has come a little bit too late, but we know that in countries where the pandemic has hit, there's always a propensity for a second wave. But then in our speeches also, it was made clear that this is not only for COVID-19, that it can be used for general ICU care, as well as the management of any other severe infectious disease condition.